So hello, Joel. We've got Joel Fuzat here with us from Aurora Cannabis. Welcome, Joel.
Thanks, Brayden. Nice to talk with you today.
And just, thank you very much. I know you guys are rocking and rolling, and it's busy times over at the facility. So I just want to thank you very much for taking time out of your schedule today to chat.
Frankly, Brayden, it's my pleasure. I know that we've been fairly quiet as a company during the pre-licensing process. Now that we're licensed, we think it's important to get some of the exciting message about Aurora out there into the ears of the people who are interested in our story.
Awesome, awesome. That's kind of my hope, my goal. So excited to hear it. We'll jump right in. Maybe tell us a little bit about Aurora, sort of from your perspective, maybe to the people that don't know who you guys are. Just shed some light on the company itself for us.
Sure. Recently, one of our board members, Dr. Jason Dyke, he coined a phrase that not only that I like, but I think everyone in the company likes because it speaks to who we are and it's simple. And the phrase is driven by excellence, backed by science. I think it's really important that people understand that Aurora gets the current cannabis market and the culture from an organic stance. Our lead grower, Chris, and myself, we were and are part of the culture, and from the top down, I'm referring to Terry Booth. We've always believed in being part of the greater movement to legitimize cannabis, not only in the markets, but at the populist level, in the minds of the people who may use it, who aren't using it, but who want to learn more about it.
Awesome, and that's one thing that, again, I'm always excited about the companies where the people in it, for obvious reasons, they're industry guys. They understand the sector. They've been around it for a while. You much more than the average bear. Do you want to maybe give the viewers, listeners, a little bit of your personal background, because it's a good one as well. If you can share that with us.
I'd be happy to. I was first introduced to the idea of medicinal cannabis. I sure knew what pot was way before 2001, but I learned about medicinal cannabis when I lived in Portland, Oregon. My neighbor had cancer, and she also had Crohn's disease, and she couldn't grow her own medicine, let alone work, to be able to afford to buy it. In Portland, then, as now, it's pretty expensive. So myself, I also had health conditions that I had gone to Western medicine for, and they really couldn't do anything for that. So I began talking more and more with my neighbor, and I got to know her as people do. I realized that cannabis could probably help me with what I was suffering from, and she convinced me I'd be helping other people by becoming a caregiver, which is the term the state of Oregon uses to call people who grow medicinal cannabis for patients. So for a number of years, I grew for several patients, and I participated quite a bit in the medical space there. I did everything from baking goods for diabetics and donating them to patient resource centers to just talking with people who grew cannabis like me. I went to association meetings, membership meetings. I spent a lot of time talking with the people from Normal and really just getting to understand why people use cannabis, why they wanted to grow cannabis, and why people want it as part of their healthcare options. It also taught me that even people who use cannabis recreationally, which is a term I don't like, even rec users have a legitimate medical use for the drug. So eventually life changed for me, and I had the opportunity to develop and manage large cannabis farms in Northern California. So I took that life and I lived it 24/7. It taught me a lot, and it prepared me exactly for what I'm doing here today as facility director of Aurora. Eventually life changed again, as it does, and I realized that I really enjoyed healthcare. So I moved to Canada a few years ago to study and graduate from a program in Chinese medicine.
Awesome. So I mean, you've clearly had a lot more industry background experience than certainly than the average person here in Canada and stateside as well. So that's fantastic to hear. Are you? I have to ask. Call it the shift that's taken place this last couple of years, and there's some groundbreaking news even on CNN today on their website. I don't know if you caught it or not, but just the shift as it relates to cannabis, the acceptance. Are you surprised by sort of how far we've come to date here, or what are some thoughts on where we are and where we're headed on the medicinal front?
Well, I'm not surprised at all. cannabis has been one of the most widely studied drugs since the 60s. I'm actually more of the mindset that I find it ironic that we today are rediscovering a lot of information that was already uncovered in the 60s and 70s, especially that cannabis has medical benefit with very, very few side effects. Of course, scientific instrumentation is more precise, it's more accurate today, so we're certainly learning more about the pharmacokinetic action of medicinal cannabis, the hows and whys it works, but we're really rediscovering what got covered up because of the war on drugs. In particular, what excites me is that Canada, with its public health and safety standards that are amongst the most stringent on the planet, as well as being filled with top-notch scientists and thinkers, I think Canada is leading the way in legitimizing cannabis in a way that not even the U.S. can approach yet. My guess is that 5 years from now, this country is going to be leading cannabis research. So let me clarify. Many countries are known for producing large volumes of research, but not all countries follow the same standards of how that research is conducted, how those studies are done. Here in Canada, everything is held to such a high level that I think, and I think we think it's inevitable, will become a model for how research into cannabis is done and done properly.
Love it. That sounds fantastic. So speaking 5 years out, tell us where you see Aurora 5 years from now, beyond. Say today, 5 years out and beyond.
Okay, I see two Auroras, one company but two parts. First, I see Aurora as synonymous with the standard for high-quality cannabis in a legal market where adults will be free to choose cannabis over or along with tobacco, alcohol, or other so-called recreational drugs. Secondly, I see Aurora as being a provider of APIs, which means active pharmaceutical ingredients, to drug companies that will be manufacturing custom blends comprised of THC, CBD, and various terpenes. Many groups make the pharma claim, but in our case, I know it's the truth. We've always taken the extra step to adhere to pharmaceutical manufacturing standards as close to 100% as we possibly can. People, patients, medico-recreational users, they deserve the best. And we believe following the path of safety and quality that the pharmaceutical industry has already laid out is the best way to go. So when that thinking is combined with a deep knowledge of the culture and the market, I think that's an unstoppable force. I guess I could have answered your question just by saying, expect Aurora's products on retail shelves in Canada and Europe.
Awesome. I love it, man. I love it. So you guys do have plans then to be outside of Canada eventually as well?
I think with the way we're structured to produce, it's inevitable. And I'm not just paying lip service to that statement.
Awesome. Let's sort of jump a little bit to the patient landscape. Anything that you're finding interesting, any trends, anything you want to share with us on the patient-facing side of Aurora?
Yeah, I think it's the most exciting trend I'm aware of, coming from a healthcare background, is that today's patient is informed, they're knowledgeable, and if they're not, they know how to find information. So with the internet at anyone's fingertips, more and more people are finding it normal to research so-called alternative healthcare to make smart, informed choices about their options. Cannabis as medicine is clearly the byproduct of the best aspect of the information age, and today, I think it began about 2 years ago, for a decade, cannabis is looking at its biggest retiring population ever. And that generation, you can call them the boomers or the zoomers, they are the people who grew up smoking pot back in the 60s and the 70s, and if they didn't, they sure heard about it. And those are the people today and tomorrow who are going to be looking at this as medicine, and that's exciting.
I couldn't agree more. One thing that surprised me being down in Denver a few times is that the average age in the dispensaries on the non-medical end rec down there, that's one thing that surprised a lot of people, is the boomers coming out. I think it's fantastic, rather than on the rec side, even, rather than a bottle of wine, they go out and perhaps get cannabis in that form, or medicinally, if you take a country like Israel, it's practically a geriatric staple over there. So I think you're absolutely right. The opportunity lies among our aging population. It's fitted perfectly. So
Yeah.
So people sort of reaching out and contacting Aurora. There's a lot of buzz here on the West Coast about the facility from sort of the industry guys about just how state of the art the facility is. I personally know several patients that are excited about the potential quality of the flower coming out to do with, for example, where it's located and the air quality, the water quality. Who so far has been sort of lighting up the phones the most and inquiring the most with Aurora?
Well, what I can say is I think it's fair to say that kind of everyone is interested in Aurora in some way. Patients, doctors, investors. I've spoken with a number of representatives from each of those groups. Without giving too much away, I can say that there's really solid interest from big, well-known entities. We've been seeing our vision manifest rapidly and tangibly, and the groups that are interested in this vision, these big entities, they're a perfect fit for where we see ourselves headed. And that's about all I'd like to say on that for now.
Awesome. No, that makes perfect sense. So on that note, because you guys are located sort of in the foothills of the Rocky Mountains, I guess is really where you guys are, would you say there's an advantage to the air quality, to the water quality, as far as other North American locations? As we all know, that's the lifeblood will be the food, the water, and the air. So can you sort of, is that something you guys are obviously aware of? But is that a real advantage in your opinion?
Definitely. I'd love to talk to this. So the quality of our air alone is a huge benefit. So given the nature of the cannabis flower, which is we may or may not know is covered with an abundance of resinous material known as trichomes, you don't really want to grow it in or near a city. Cities are filled with toxic particles that may be more or less safe to breathe on a daily basis, but due to how those accumulate, those particles, how they accumulate on cannabis as it grows, let's just say the average patient or person doesn't want that in their bodies. For example, you wouldn't want to brew a vat of beer wide open in a city for anything to fall into it, right? Same thing with cannabis. Our water quality is amazing. The only processing our water requires is reverse osmosis, and we only do that to standardize it as part of our fertigation program. We don't have to remove chlorine, or something that most people don't think about is the drugs people take and excrete on a daily basis into city water supplies. I'm referring to pharmaceuticals.
Yes, that's right. Yeah.
Yep. As testing equipment became sensitive enough to test into the parts per billion range, it actually turns out that city water treatment systems can't filter out the pharmaceuticals that people take. This could be birth control all the way to psychiatric medication. With no existing studies on whether or not those elements in city water have an effect upon cannabis, for us it just makes sense to be out here where we don't have those issues.
I love it. It's funny because I just read an article not long ago that says when you drink your tap water, you're quite literally consuming, SSRI medication and other psychoactive medications that may have been flushed, may have been, whatever form they made it in that did not get filtered out, and we're all consuming it. So that's fantastic to know. So the facility itself, I know a little bit about it now, having spoke to you and spoke to Terry and had the luxury of seeing it. Thank you guys very much. Tell us, to somebody who doesn't know, just fill us in on it from a layman's term, the facility itself, if you don't mind.
Well, rather than paint a picture of lights and tables and places where cannabis can be processed and grown, let me just say we truly believe it's state-of-the-art, one of the most advanced facilities on the globe. This isn't just how we feel. Well, it's how we've always felt, but this is certainly the message we get from anyone visiting the facility. Some of the top industry representatives have come through and literally left with their jaws on the floor. It's one thing to read or hear about the facility, but it's an entirely different thing to experience it and see this magic in person. So let me just leave your listeners with that feeling because it's real.
Awesome. I wanted to switch gears a little bit and just discuss with the recent Kirk Tusaw case and other things in the political landscape,
Sure.
Extractions. Any plans, or let's even say any preparation, if you will, for a change in legislation on your guys' side to become involved on the extraction side of things?
Well, nobody can ignore what's happening in markets like Colorado or Washington. We certainly aren't. Edibles and extractions, they have huge market potential. The edible market alone, the last I checked, was about 60% of Colorado's current market. And the foundation for edibles is extractions, for consistent, safe edibles. So I think it's safe to say that any company with vision is looking at all of that with keen interest. And given the way Aurora approaches things now, you can imagine, should we become involved with extracts when they become legal on a national scale, we're going to hit the ground with tires smoking, driven by excellence, backed by science.
I love it. I love it. So what is your key message then to Aurora patients today?
Well, I've always prided myself on being able to grow really incredible medicine with not even a tenth of the resources that Aurora currently has at its disposal. Based upon the feedback from a lot of people on what I was able to produce in the past and what our grower, Chris, is currently able to grow, and given the amount of brain trust and cultivation knowledge we're utilizing from true cannabis experts, people who love the culture and the plant as a medicine, all I can say to patients is you are in for an amazing treat each and every time you open a bottle of cannabis from Aurora. Not just overall quality, but knowing that we completely understand in how we grow it the subtle dynamics of the medicinal components of cannabis, way beyond the THC and CBD levels that most other people seem to focus on today. So when we call our cannabis medicinal, we really mean it. You can know that our product, when it's available, will be clean, tested, grown with love and respect for our patients.
Awesome. And I'm just having a peek on your site right now. So if I'm interested in getting more information, I guess it would be auroramj.com/patients. I'm just looking here. All the information is there and looks fairly straightforward. Any notes or tips for anybody interested in becoming a patient or asking for more information?
All I can say is when we're ready to go to market and begin shipping, just keep hitting refresh on that page. All of our announcements are going to come through there. You can sign up for more information. I believe at the bottom of the page. Sign up, keep refreshing the page, and you'll get the news same time as everyone else.
Awesome. Well, thank you so much, Joel. Really, really appreciate it. And if anybody wants to contact you at the facility, I'm sure you're available as well. But a very, very knowledgeable guy. It's an honor to have you and an honor to be a shareholder and have somebody like yourself involved in the team. Instills a lot of confidence in myself as somebody who's been watching this for a long time. So again, I really thank you for taking the time and regards to everybody there, and we'll hopefully get an update from you very soon.
I hope so too, Braden. And just to touch on what you said, if people have questions, I'm available. Contact me. I'm happy to talk with people. I always have time to talk with people with sincere questions about Aurora.
Awesome. And if I can drop, so joel@auroramj.com. Is that correct?
Absolutely.
Joel@auroramj.com. All right. Well, thank you, Joel. Have a fantastic day, and we'll talk very soon for an update.
Take care, Braden. Thanks for having this interview today.
Awesome. Thank you.